Okay, now we're going to look at management of pelvic injury.
Okay, so we're now going to demonstrate the application of a pelvic binder. What the pelvic binder allows us to do is to restore normal pelvis anatomy. So when it comes to blunt traumatic injury, the pelvis in large force blunt trauma is at risk of becoming fractured. There are different fracture patterns that are seen, but the overall risk really of a pelvic fracture is disruption to blood vessels, both the arteries, so the iliac arteries, but particularly, I guess, the venous plexus that runs around the back of the pelvis is often disrupted and can result in significant, potentially fatal bleeding, which is really difficult to get control of. So one thing that we can do nice and early to try and help these patients is to apply a pelvic binder to restore the anatomy, which reduces that bleeding or potential bleeding into the pelvis. So the indication will be that the patient sustained blunt force trauma and we suspect or there's a risk of a pelvic injury. So we're going to assess for pelvic injury by looking at the symmetry of the pelvis, but we're going to be quite careful not to apply any direct force onto the pelvis as we assess for injury. So we're going to have a look. We may use our fingers to feel for the anterior superior iliac spine, check its alignment. But if there's suspicion, we're really going to lose nothing by applying a pelvic binder. In order to apply the pelvic binder, we're going to think about the landmarks that we are going to identify and where we're going to place the device. So I've already found the anterior superior iliac spine, but we want to be applying the pelvic binder beneath that over the greater trochanters to try to bring the femurs and then the pelvis back together to close it to reduce the bleeding. So I'm going to go from the anterior superior iliac spine. I'm going to work my way down on both sides, feeling the greater trochanters of the femurs, which are nice and prominent, quite like there. I can feel that. Another trick that people do is to put their thumb on the spine of the pelvis and to point downward. And the index finger usually finds its way onto that prominence of the greater trochanters. So I've got that there. So we're going to then bring the device over, and then we're going to apply controlled traction to draw this device closed, and that's going to help us to restore that normal anatomy. There we are. So that's just applying tight pressure around the pelvis to restore the normal bony anatomy.